Hello, I'm Dr. Pinnella at the South Florida Center for Cosmetic Surgery. And a few words about tummy tuck. First of all, a lot of people need tummy tucks because who's got a perfect abdomen? And if you do have a perfect abdomen, guess what? Your time's going to pass, or you're going to have a child, and then you need to be put back in your original condition. So we do a lot of tummy tucks. Very commonly, women that have had children, when they're finished having their children, while they're still young and before they got too old, they want to get their body back, so they do a tummy tuck. Also, a lot of people getting weight loss surgery, and you get weight loss surgery, the tummy gets very loose, you got to tighten it back up again. Tummy tuck's a great operation because there's nothing like having a nice flat abdomen. Now, we use a very low bikini incision, so it's nice and low, so you can still possibly wear a bikini if you want to. Now, we take out a piece of skin and fat from the lower abdomen. The muscles often are spread apart in the midline from childbirth. We put stitches back in there to tighten those muscles back up. Some people from childbirth, they might have a little hernia in the navel. We fix that at the same time. And sew you up, put you in a girdle. Usually have a drain in for about a week. And most people that have this operation go back to a job if they're working at about 2 weeks out. But it can take up to several weeks, a month, or even 2 months to fully recover. That doesn't mean you're laying in bed. Even after the first day, we want you walking around and doing some basic things. But tummy tuck's a great operation, very popular. Okay, there's mini tummy tuck and a regular tummy tuck. Generally, mini for any procedure means less of a result. Less surgery, but less of a result. Most people want the full result. So a full tummy tuck is what most patients get. Now, if you just have a little bit of looseness, a little bit of something needs to be tightened up a little bit, you can get away with a mini tummy tuck. But most of the time, you want the maximum flattening and tightening of the abdomen. Now, when people talk about a mini tummy tuck, perhaps, well, there's several versions depending on the body type you're dealing with, but generally the incision is not as long. You're not cutting out as much skin or as much fat. You may do a little liposuction of the abdomen with that, but usually you're not doing muscle tightening or really pulling the whole abdomen flat and tight. So for making the incision a few inches longer and doing a regular tummy tuck, you get a much better result. So that's what we do most of the time. Now, suppose you want to have a tummy tuck. Well, you contact us and we make the appropriate arrangements. Some patients are local, some people fly in from other states. We like to have some lab work done before you come so we know that you're healthy and fit for surgery. When you arrive here in Fort Lauderdale, the surgeon, myself or one of the other surgeons, will check you, discuss what we're going to do, make some markings on you. The anesthesiologist, and we use board certified MD anesthesiologists for the anesthesia. They talk to you too, and they tell you how they're going to give you anesthesia. Then we take you into the back to the operating room, and a few seconds later you're asleep. A few seconds later you're awake again, and there's dressings on and perhaps some compressive garments. You're transferred to the recovery room where you'll be monitored, your heart's monitored, blood pressure, pulse oximeter. There's a registered nurse watching you, making sure the recovery goes smoothly. And then when you're fit to go home or go back to your hotel, then you're released. And we call you that night to make sure everything's okay. And the next day we check you and make sure everything's good, and we change the dressing. And then the appropriate time, might be a few days or a week or so, you can fly back home. All right, now, how long does it take to recover from a tummy tuck? Well, in general, most things in the human body take about a month to heal. A broken bone takes about a month to knit. Open heart surgery takes about a month to heal. Removing a mole even takes a month to heal. Everything takes about a month to heal. That's just a ballpark rule of thumb. That doesn't mean you're in bed for a month. Even after a tummy tuck, we want you to walk around a little bit, even that same evening. We don't want you laying around too much. It's not good for your circulation. The next day we check you, you change your dressing. At that time we discuss what you can be doing, which is you can't even shower. You can shower the next day. There'll be tapes on the incision. There'll be a drain. That can get wet in the shower. and then you just put the binder, the girdle, back on, and you gradually increase your activity over several days as you can, as tolerated. Sometimes you can get constipated after this operation, so if you're not having a bowel movement every day, you should take a laxative. That'll help you feel less bloated and less tight. You will feel a little tight at first because that's what we're trying to do. We're trying to tighten up your abdomen. So it may feel even too tight for a few days. You might have to walk a little bent over when you walk. But the final result should be nice. You start seeing swelling go down after the first few days, but it can take up to 2, 3, even 4 months for all the swelling to subside. It can be several months before you're fully recovered and everything is totally back to normal. So this is not an operation you want to do 2 weeks before you're getting married. You want to allow yourself some recovery. But you're not laid up, really. A lot of patients say they're surprised how little discomfort they had compared to what they were expecting. As far as gym workouts, generally you can work out after most of these operations at about a month. Most things take a month to fully get back to initial tissue breaking strength. So at about a month you can safely do most activities as tolerated. You may not be up to your full strength though yet, but we don't want you laying around. We want you active and doing things. Now, how to get the best results from your tummy tuck. Tummy tuck's a big operation, so that's a good time in life to start looking at your lifestyle. Are there things in your diet you could change to improve your general health? How's your activity? Could you start doing some walking or some exercise in the gym, whatever? If you're smoking, stop smoking. Try to get a fresh start on life. Now, vitamins are very helpful for healing. Vitamin C is necessary for collagen formation. Collagen is the structural protein that forms scar tissue and bone and all the structural tissues of the body. So you need a lot of collagen forming when you're healing from a tummy tuck. So you need some high doses of vitamin C, even 2,000 or 3,000 milligrams a day, as long as your stomach doesn't get irritated from that dosage. Now, scars, the best scars, we want good scars, okay? But the scar is secondary. It's going to be a low, gentle scar low in the bikini line. So most importantly, to get a nice flat belly. Nevertheless, we usually sew the incision with dissolving stitches under the skin, so you don't get like railroad track marks. We don't use, in general, we don't use staples or stitches on the outside, which can leave marks. We want as nice a scar as possible. And also, the best scars come out with taping. Taping a scar gives you a better result than any scar creams. Now, it can be inconvenient, but scar tissue generally starts forming at about a week and it reaches its maximum at about a month. So, for most cases, we like patients to keep the incision taped for about a month. If you keep it taped for 2 or 3 months, so much the better. If that's inconvenient, you can use one of the scar creams. So I hope you've learned something from what we've just discussed. If you have further concerns or questions, you can reach out to us. We're happy to address any concerns you may have. You can also look at a pop-up video that should appear of one of my patients. And we have many patients. We can show you many pictures. We have many people that have left endorsements of all kinds. So we're here for you. So if you found this video informative and helpful, please give us a thumbs up. We appreciate that. And subscribe to our channel. And hopefully we'll see you soon.